मैं डॉक्टर प्रोफेसर विवेक गुप्ता आज पेरिस में हूँ एंड इट इज़ 19 मई 2022 दिन है आज बृहस्पतिवार थर्सडे को। एक बहुत बड़ी कॉन्फ्रेंस होती है पेरिस में जिसका नाम है यूरोपीसीआर। हम लोग जो कॉन्फ्रेंस करते हैं दैट इज़ नोन एज इंडो यूरोपियन कॉन्फ्रेंस IECR, बट दिस इज यूरोपीसीआर। यूरोप में होती है, मोस्टली पेरिस में होती है। और आप देख पा रहे होंगे कि दिस इज़ द लार्ज एग्जीबिशन एरिया जो कि बहुत ही सुंदर भी लगता है और काफ़ी आई थिंक इट लुक्स सो एक्स्ट्रा वैगेंट। दिस आर एग्जीबिशन बूथ हैं जो यहाँ के आप देख रहे हैं। यू कैन सी दिस इज एडवर्ड दिखाओ। देन द बूथ विच आई एम स्टैंडिंग इज बॉस्टन साइंटिफिक। दीज आर द मेजर कंपनीज जिन्होंने स्टेंट को डेवलपमेंट में, द वाल्व को सर्जरी के डेवलपमेंट में कंट्रीब्यूशन किया है। दीज आर द वेरी इंपॉर्टेंट कंपनीज। ऑन द अदर साइड यू कैन सी टेरोमो विच इज़ बेसिकली लॉन्ग वायर कंपनी। और चारों तरफ आप देख रहे हैं कि तरह से मेला टाइप का लगा हुआ है विच इज़ ए वेरी इंपॉर्टेंट एस्पेक्ट। पूरे दुनिया से अबाउट देयर आर 7,000 to 8,000 पीपल हु हैव कम। आई एम रिप्रेजेंटिंग इंडिया, मैं इंडिया से हूँ यहाँ पर। इंडिया से काफ़ी कम लोग हैं इस समय बिकॉज ऑफ कोविड, अदरवाइज ऑल्सो सो वी आर एंजॉइंग दिस प्लेस एंड आई होप यू विल ऑल्सो सी दैट दिस इज़ द डेवलपमेंट प्लेस। होता क्या है कि द फर्स्ट स्टैंड जो लगा था स्विट्ज़रलैंड में, अब डॉक्टर सिगवर्ट मुझे मिलेंगे तो मैं आपसे बात करूँगा। एंड पहला एंजियोप्लास्टी हुई थी 1977 में। जो ये दिस कंपनीज आर वेरी इंपॉर्टेंट बिकॉज दे फाइनली डू द फंडिंग फॉर द न्यू रिसर्च एंड इनोवेशन and then they put the exhibition booth for the showing that what is coming in the future, what will be the next stage. मैं आपको I'll just take you around and show you Abbott company. This is Abbott company. Abbott ये सर्जिकल वाल्व भी बनाते हैं और अभी नया टेक्निक आया है ट्रांसकैथेटर एओर्टिक वाल्व इम्प्लांटेशन। उसके भी जो वाल्व आता है जो क्रिबियर, डॉक्टर एलन क्रिबियर जो हमारे मेंटर थे उनके साथ कोलैबोरेशन करके इन्होंने बनाया। इसका नाम था क्रिबियर एडवर्ड वाल्व। नाउ दे हैव चेंज द नेम टू एडवर्ड सेपियन वाल्व। सो आई विल जस्ट शो यू और टेक यू अराउंड, टेक द बैग, टेक यू अराउंड एंड शो यू कि किस तरह के बैग्स हैं। एंड दीज आर द जैसे दिस इज पास्कल रिपेयर सिस्टम फॉर दिस इज समथिंग विच इज ऑटोमेटिक क्लैस्प एंड क्लोजर इन योर हैंड्स। See what Pascal is made about. So इस तरह के सारे एग्जीबिशन में दिखाते हैं ये पोस्ट इम्प्लांट रिलीज। And lot of people are here. I'm doing the Facebook live, just telling you. So people are watching here. और साथ साथ यहाँ पे कुछ चाय पानी नाश्ता जूसेस चलते रहते हैं। So I'm very impressed with this system and I am coming in this conference for almost 20 years. 1997, 98 में I used to work with Professor Alan Cribier in Rouen. मैं रुआ भी जाऊँगा परसों तो आपको दिखाऊँगा वहाँ पे क्या है। एंड I will just walk through करते हैं। चेतन my son has come to attend this meeting and he is doing MBBS 3rd year from Santosh University. So I'll take you through. अभी दिखाते हैं और क्या क्या है यहाँ पर। Cordis was the first company to start the stent. शुरुआत में स्टेंट हुआ था तो दिस वाज द जॉनसन एंड जॉनसन कंपनी। बाद में these are the stalls, watching, learning, eating and then I will take you to the halls. अभी हॉल जहाँ पे लेक्चर्स हो रहे हैं, जहाँ टॉक्स हो रही हैं। and here Chetan is also watching other places. मोस्टली इंटरनेशनल मीटिंग है, पूरे वर्ल्ड से लोग आए हुए हैं। एंड यू कैन सी द इंटरनेशनल फ्लेवर। दिस इज एबर्ट, अनदर बिग कंपनी, एबर्ट वेस्कुलर, जो कि स्टेंट होता है एंड देन यू कैन डू द लर्निंग ऑन साइट। फॉर एग्जाम्पल दिस इज द एबर्ट closer device.
Okay.
This is the closer. Are you from the company?
Yes.
So we are doing showing to Indian people.
Oh.
Okay. So can you just explain briefly what it is about?
How it works, okay? My hand weight.
So you are you are Lucy
Yes,
from Abbott. Which country you are from?
UK.
UK, United Kingdom. Boris Johnson's place.
No.
You don't like him. So we are here. Chanchal, can you do the recording? I want to second device. Show me.
So
This is a closer device.
yes.
So let me explain to you. What is the closer device? When we do any angioplasty or any technique with a large device on the groin, यानी कि जो जांग की नस में हम लोग जब एंजियोप्लास्टी करते हैं या कावी का प्रोसीजर करते हैं तो आर्टरी के अंदर एक छोटा सा छेद होता है उसको हम ऑटोमेटिक रादर देन कंप्रेशन वी कैन क्लोज दिस विद द हेल्प ऑफ अ डिवाइस तो वो जो एक ऑटोमेटिक सूचर बन जाता है विदाउट कटिंग इट एम आई राइट यू मेक अ सूचर इनसाइड द आर्टरी शो हर inside the artery. Yes, how do you do it?
The way that we do this
What is the name of this? Proglide.
Proglide device.
So it is a Proglide device. Proglide from Abbott.
Wait a
So
second.
we load it onto the wire after we've pre-dilated with a 6-French sheet.
6 French sheet.
The white one
You please talk
is the
here. Talk here.
last one that you are going to take. No,
So then
start with this
we
one.
feed
You
the
take
wire
blue
in
one.
to the sheet.
You pull. You pull?
I want to.
Wire will come out
I
here.
must put blue.
Yeah.
Feed the device inside. So this is skin level. This is vessel level.
Don't touch.
So wire.
This is skin.
Don't
This is
touch
skin.
it.
Of
This
course.
is
Leave it
vessel.
there. Okay.
No.
Wire
Leave
comes
it there.
out.
Don't touch
Take
this
out the
suture.
wire.
Just take this
So
one.
at what level you have to remove the wire? At what level?
Skin.
Okay?
Skin level.
Once we are
Once
there,
once you have this mark
Yeah.
at the skin,
Yeah.
you remove the wire. Okay.
So then
You
advance
introduce
the
it here.
device until you see pulsatile flow come from this port here.
Okay.
Blood flow will come from here.
We
Yes.
take this away.
So that would be about now. We get blood flow.
Okay.
We then perform step 1,
You continue pulling
which
back.
opens the foot plates
with
of
the
the
right
device.
hand
So I
to the
don't know whether you
left
can
hand
see
side.
in there.
No,
We have
left.
foot plates open.
Left. You take
So then
the
we
suture.
put some tension on the device and hold it at 45
Okay.
degrees.
You connect
45 degrees.
this.
This
Like
way.
this. Let me
It has to be
like this.
faces.
And then
So you do this.
And then you press down the step 2, the plunger.
It has
press
to be
here.
up faces.
Show this
So
hand.
you
Show
have to
hand.
do it
Okay.
this way.
So you can
If
see
do it
here,
this way, you won't be
we
able
have
to go
fired
down.
2 needles through the
should
vessel
be
wall,
this way.
which will place the suture in the vessel wall. Okay? So then for step
You go
3,
down.
we pull back
You go closer
Shoot
to
ahead.
the patient.
on this plunger.
Okay.
You can see there's a suture attached to this needle.
Yes. Now the suture has done.
Okay. The closer you are,
We
the
pull
better
around the device to trim
This
the
needs to
suture.
be tense. Okay? Tight.
So then
Very
step
tight.
4,
This is correct.
we lower down the foot
Wait.
plates so that we can remove the device from the vessel.
You take the pusher away. If you see
So
that there's
then
no
when we get to
bleeding,
skin level,
it would be the right
we
moment to
remove the
take the guide
sutures. Do you
wire
mind comping these for me,
If you
please?
need to
Use
do the
that
second
button.
device,
Hold them.
you would do it at the start of the procedure.
Assistant will
Gently,
do
don't
this.
hold, don't
And you
hold,
would
just
put the
gently.
first one,
Okay, so then
leave the sutures at one
we
side.
rewire
You would
through the
introduce the guide
device
wire
so we
again.
do not lose access to the
The
vessel.
second one, okay? So, hold on, because...
Rewiring.
Hold on.
Wiring is done
Take
again.
the guide wire away.
And then you take out
We
the.
remove the device.
That's what we're doing.
So now
You connect.
we have to manage the sutures to push down the knot onto the vessel wall. So we identify 2 sutures. One is white and one is blue. This is the white
Don't
one.
do it this way.
This will lock the
Better.
suture in place.
But
So
you
we do
start
not
at
want
the
to
upper
pull
part,
that
you
until
connect
right at
it,
the
and
end.
then you go straight back.
So we get the blue suture
You can repeat it yourself.
Around
so
the index
you
finger.
know how to do it.
4 or 5 times.
Okay?
We get our this
Straight.
tool here, which is called the suture trimmer.
So now, once we have closed
We place the
part
suture
with the guide wire
into
left
the
there,
trimmer using this port
you
here.
take with your right hand
Place
side,
it inside
you take the other suture.
slide
No,
down.
keep it that way.
to push
Exactly,
the
and
knot
you pull back to your in direction
closed.
to your body.
And you see the knot is closing now?
Okay? So once you have done that,
See the
you take
vessel
away
is
the-
closed?
Yes, yes.
and you take
So
the
now,
two
when we
sutures
have
together.
hemostasis,
No, remember
we
what I told you.
remove the guide wire because we are happy we've got no
The pusher
bleeding.
has to be exactly. And now you go down.
We then lock the suture in place
You
using the white thread.
Exactly. That's perfect.
Okay.
1,
So that's
2,
that's the
3.
one. Okay. Can I
Then
scan
remove
your
the suture trimmer. We get both sutures,
just so we know
in
that
the
we're
trimmer.
here. We're interested.
place again, slide down, and we use this lever here, the red one, to trim them.
Yeah.
how it's done. Yeah.
And you can see now, on the outside of the vessel you have your knot, and on the inside of the
Yeah, I
vessel
don't
you
forget that.
have
Is
the
this
suture
yours?
type.
Very
That's
good.
it.
Yeah.
Okay,
Perfect.
bye.
I will show you. I will just briefly explain what she has done in Hindi also in my language, and show both of us. This is actually a device. Can you look at the camera? It is actually a device which has done a suturing, not inside the vessel, without doing a cut open. That means you don't open the surgically open. You have done non-surgically closure of the hole
Percutaneous.
percutaneously, which is that means without opening this. And with this percutaneous technique is done by the Proglide. The name of the whole system device is Proglide, and this Proglide system helps in immediately suturing and closing the hole which is made inside the femoral artery, and that helps and prevents the complications of hematoma, and it also helps in immediate closure of the hole which has been made by a 14 French sheet. Is it possible for the 14 French sheet also?
Yep. Two devices are used for 14 French sheets, but in exactly the same steps.
That means after carving we can use this.
Yeah, so you need to put them in first. So you pre-deploy two sutures, like this, and then you continue on with your procedure with a 14 French sheath, and then you tighten the sutures at the end.
For 14 French you need two sutures
Yes,
because it's a large
it's a
hole.
large hole.
And do you recommend this for the 7 French sheet also?
Yes, so if you wanted to close a 7 French access site, you would just need the one
We
device.
do routine angioplasty after 6 French.
Yes, yeah.
Because what we do in India, that after 6 French angioplasty, we don't remove the sheath immediately, and after 2 hours when the ACT, the activated clotting time is normalized to 30 seconds,
Yeah.
then we remove and do the compression. This is compression.
You can use this.
This prevents the compression.
Yeah, you
need to have compression after this?
No,
Zero?
no.
Zero compression.
No compression.
Okay.
If you were going to use this after the procedure, hours after, I'd place some local anaesthetic at the side.
Of course.
Just for comfort of patient. But yeah, you need no manual compression with this device, and also you can ambulate the patient earlier.
Yeah, of course.
So because the groin is secure with a suture, you can ambulate the patient 2 hours following arterial access.
Patient can walk after 2 hours?
Yes.
That's a very good thing, because normally when we remove the sheath and when the patient do compression, it is the next day normally, after 12 hours, 14 hours of lying down.
No.
The patient feels very confident.
Yep.
He's walking after 2 hours. So whenever we do angioplasty from the groin, then if you use this technique, we are not using this in Apollo Delhi. I am from Apollo Delhi, Apollo Hospital. I'll give you my card.
Okay.
So I think you ask somebody in India to meet us, and we can
Yes.
start using this.
Yes, of course.
And
Your patients can sit up at 45 degrees also immediately after a deployment. So if you were to use 2 Proglides on your TAVI patients, 1 Proglide on your angio patients, they can sit at 45 degrees immediately, have a drink, feel more comfortable.
after TAVI, how much time the patient can ambulate? Even after TAVI, 14 French?
Because the groin is secure with the
course,
vessel.
you put it
It's
not-
sutured. It's sutured the vessel. As long as you maintain access to the groin with the Proglides, and then you close the 2. If you just kind of monitor the groin for about 2 hours, and if there's no bleeding, they're set up at 45 degrees, they can begin to walk.
But I think it's always better to do a small compression for another half an hour or so.
You don't need
After,
to.
it's not done.
No, compression with the Proglide will not be necessary. You will get immediate hemostasis on the table.
Okay, but is it harmful or it is not useful? Or it is not required?
Not required.
It's not required. It's not harmful also. If you
I
do
would say it might help. I don't think it's any use because
there's no need to do any compression, because normally when we do compression and then we put the ball to the elastocape bandage,
understand.
it's not required.
No,
It's simple bandage.
just a dressing.
That's it.
Yeah.
Okay, thank you very much, Madam Nancy Shadwick.
Yeah, nice to meet you.
You are from
UK.
other part of Boris Johnson.
Not where Boris Johnson lives now.
He comes to India very often.
Yeah, we don't like him. You can have him. You can have
You
him.
want Boris Johnson to become president of India
Yeah, instead of the UK.
and instead of UK, and then
And we can have someone else.
unless Mr. Modi comes to UK.
Okay, maybe not.
Or maybe not. Then whom will you like?
Anybody from the UK who is not Boris Johnson? Me.
Maybe Lucy.
Me.
She's the future president of or Prime Minister of UK. You have to watch it, and then I'll come and visit you in Buckingham, not in 10 Downing
10
Street.
Downing Street.
She's going to be the resident of 10 Downing Street, which is the place of residence of Prime Minister of United Kingdom. I'll come with you. Don't forget me.
I won't forget.
Thank you very much for watching this video, and myself, Lucy, and Chatan are putting off the Facebook Live from Europcr on 19th of May 2022, and we'll come back with other procedures very soon. Thank you very much. And this is also Madam
Sophia.
Sophia
Yeah, from Spain.
from Spain. But she's all well. Okay, she's from Spain, and she's also part of the company which is Abbott Vascular, very popular company. And I'll take a picture with both of you.
Okay.
Thank you so much.
Thank you.
I'll take a screenshot.
Okay, perfect.
Thank you, and thank you for watching this video, and I'll come back to you. Thank you very much.